Hello, thanks for visiting my website. My name is Tiffany Stanley, and I'm a licensed professional counselor and supervisor, as well as an ASAT certified sex therapist and a PhD student in clinical sexology. I'd like to take a little time today to talk to you about infertility. Many times I have individuals and couples come to my office who are struggling with infertility. Perhaps they've been trying to get pregnant for some time and have been unsuccessful, or they've suffered the loss through miscarriage. It can be a very difficult and stressful time on an individual, but also on a couple. Sometimes individuals or couples have come to see me because they've been trying for some time unsuccessfully to become pregnant, and they're now in this place where they're trying to decide what to do next. You know, there are many different options available, but it is a decision to make on which avenue to pursue. The whole process of trying to become pregnant and maybe even struggling for some time and not being able to become pregnant, it can put a lot of pressure on an individual and a lot of pressure on a couple. I often see individuals start to not have the trust in their bodies that they maybe once had, or their self-esteem begins to decrease. Perhaps they start to pull away from other people, social activities, or other individuals who have children or are thinking about having children. I also see couples who start to have conflict within their relationship. Perhaps they're not communicating as well as they used to, or they're just pulling apart from each other. All in all, the process can become very difficult and very stressful, but it doesn't need to be. Therapy can be a great avenue for an individual or a couple to come together to talk about what they need, what's working for them, what's not working for them, perhaps problem solving, what to do next. It's also a great place to talk about worries and concerns, to strategize things that one can do or a couple can do for self-care, for ways to connect with each other, for ways to have fun with each other. Many times individuals within a couple start to look at sex as a process to achieve an outcome. Of course, that outcome is a healthy pregnancy. But in doing so, they often pull away from what sex is really meant to be about within a couple, and that is intimacy and fun and connecting and feeling close to their partner. If you're struggling with trying to get pregnant and not being able to be successful in that, or you're trying to decide what to do next in the infertility process, or your relationship feels stressed and your partnership feels stressed, or perhaps you're not feeling very good about yourself at this time, I greatly encourage you to seek out help. You are always welcome to reach out to me. I offer a 15-minute free phone consultation, at which time we can talk about what's going on for you. You can ask any questions that you have, and if it feels like we're a good fit for each other, you can always schedule an appointment to continue therapy. The most important thing to understand is that it is a common understanding that infertility can be a very stressful and difficult time, but it does not need to be. And if you're struggling, it is important for you to reach out for help and to take good care of yourself. I wish you all the very best. Thank you again for visiting my website.